Good day, royal enthusiasts. Welcome back to Danish News Daily. And today, we need to talk about why Queen Mary just showed up at the Danish Heart Association. And no, it was not just for a quick photo opportunity and a cup of tea. This visit is part of something much bigger, much more strategic, and frankly, much more important than most people realize. Whilst other royals are cutting ribbons and waving at crowds, Mary is rolling up her sleeves and diving deep into prevention strategies and support systems for congenital heart disease patients. And if you think that sounds boring, buckle up, because this is actually a masterclass in how modern monarchy should operate. If you love seeing royals actually making a difference, hit that subscribe button and ring the notification bell, because we are tracking every move Queen Mary makes, and trust me, she is just getting started. So let us break down what actually happened at this visit, shall we? Queen Mary arrived at the Danish Heart Association headquarters, and instead of the usual glad-handing routine, she sat down for serious discussions about prevention strategies. We are talking about actual policy conversations, evidence-based approaches, and long-term planning for how Denmark can better support people living with congenital heart disease. This is not royal pageantry, folks. This is Queen Mary using her platform to shine a spotlight on a cause that affects thousands of Danish families, and doing it with the kind of focus and intelligence that makes you wonder why more royals are not following her lead. Now here's where this gets really interesting. Congenital heart disease is not exactly a glamorous cause, is it? There are no galas, no red carpets, no celebrity ambassadors falling over themselves to get involved. It's complex, it's medical, and it requires genuine commitment to understand the nuances. But that is precisely why Mary's involvement matters so much. Anyone can show up to a charity event and smile for the cameras. It takes real dedication to engage with the nitty-gritty details of prevention strategies and patient support systems. Mary is proving she's not just a figurehead, she's a force for actual change. Let me paint you a picture of what congenital heart disease actually means, because I think context is crucial here. We're talking about babies born with heart defects, children who need multiple surgeries before they even start school, families who live with constant anxiety about their child's health. These are not small issues that can be solved with a one-off donation. They require sustained attention, coordinated healthcare strategies, and ongoing support networks. By focusing on prevention and support, Mary is addressing the problem from multiple angles, which is exactly the kind of strategic thinking we need from modern royalty. But here's what really sets this visit apart from your standard royal engagement. Mary didn't just show up, shake some hands, and leave. She engaged in detailed discussions about new prevention strategies. That means she's being briefed on medical research, understanding risk factors, and learning about innovative approaches to early detection and intervention. This is Queen-level homework, people. She's putting in the work to actually understand the issues so she can be an effective advocate, not just a pretty face on a brochure. And speaking of advocacy, let's talk about the power Mary wields in this space. When a queen shows up and says a cause matters, suddenly it matters to everyone. Funding increases, public awareness grows, and most importantly, the people suffering feel seen and validated. Mary's visit to the Danish Heart Association is not just symbolic, it's strategic. She's using her position to amplify voices that would otherwise go unheard, and to push for systemic changes that could save lives. That's not just good PR, that's genuine leadership. Now here's the part that absolutely fascinates me about Mary's approach to royal duties. She could easily coast on her position, attending safe, easy events that require minimal engagement. Instead, she consistently chooses causes that demand real involvement and genuine understanding. Whether it's mental health, domestic violence, or now congenital heart disease, Mary gravitates towards issues that matter deeply but don't always get the attention they deserve. It's like she looked at the royal playbook and decided to write her own chapters.
But let's also acknowledge the timing here, shall we? Mary is still relatively new to being queen. She officially got the title when Frederick ascended the throne, and she could be forgiven for taking time to settle into the role. Instead, she's hitting the ground running, establishing herself as a queen who doesn't just wear the crown, but actually uses it to make a difference. The woman is setting the standard for what modern queenship looks like, and honestly, other European royals should be taking notes. Here's what this visit really tells us about Queen Mary's vision for her reign. She understands that in the 21st century, royalty can't just be about tradition and ceremony. It has to be about impact and relevance. By focusing on tangible issues like heart disease prevention and patient support, Mary is demonstrating that the monarchy can be a force for public good, not just a relic of the past. She's building a legacy based on service, not just succession. And here's the kicker. This visit to the Danish Heart Association is not a one-off. It's part of a broader pattern of engagement that Mary has been building for years. She's creating a portfolio of causes where she can have genuine impact, where her involvement actually moves the needle. That kind of strategic approach to royal duties is rare, and it's exactly what makes Mary such a compelling figure in the modern monarchy landscape. Thanks for watching, and stay tuned to Danish News Daily.